Now let's look at the proper steps to perform extractions. In an extraction, you will manually remove comedomes or blackheads from your client's skin. Extractions may be the most important skill an esthetician learns. If performed incorrectly, they can cause skin damage, infections, and scarring. It's important to check with your state board to find out how much training is required and what types of implements you can use for this treatment. For example, some state regulations will allow the use of lancets, while others may not. Extractions are only performed after the skin has been cleansed and prepared properly. Preparation can include steaming, exfoliation, and disincrustation. These methods loosen the keratin plugs in the follicle to make extraction easier. Performing extractions right after steaming or massage is preferred, as the skin is still soft and warm. Do not apply too much pressure, as it can bruise the client's skin. Never force an extraction. If the contents are not expelling, leave the extraction for the next treatment and proceed to the next area. And remember, 10 minutes is the limit for performing extractions. Any more time could be too aggressive for the skin and make your client uncomfortable. To begin, always wash your hands and put on gloves. Next, place eye pads over your client's eyes. Position the magnifying lamp over your client's face. Always look through a magnifying lamp when performing extractions. Keep in mind that advanced acne cysts and nodules should only be removed by a dermatologist. There are 3 techniques for removing comedomes: manually using the fingertips wrapped in cotton, the use of cotton swabs, or if your state allows, the use of lancets. To remove a comedome manually, wrap your fingers with damp sterile cotton or gauze pads, moistened with a few drops of astringent. Use the sides of your fingertips to exert pressure on the skin surrounding the comedome. Apply slight pressure from side to side, alternating angles, to gently lift the comedome from the follicle opening. Comedome extractors can be used for this. Do not squeeze with your nail. Only use the sides of your fingertips. Start at the chin, pressing down, under, in, and up, working around the plug. Bring your fingers in around the follicle without pinching. Place the debris on a tissue. After you finish the chin, move on to the nose. Slide your fingers down each side of the nose, holding the nostril tissue firmly, but do not press down too firmly on the nose. The fingers on top do the sliding, while the other one holds close to the bottom of the follicle. Do not cut off the airflow to the nostrils. Use of a comedome extractor is also an option for easier extractions on the nose. Slide your fingers together down the cheeks, holding each section of the skin as you go. Your lower hand holds, and your other hand slides toward the lower one. For the forehead and upper cheekbones, extract as you did on the chin, pressing down, in, and up. To remove a comedome using a cotton swab, hold the swab between your index finger and thumb and gently press down on both sides of the follicle. If the contents do not expel right away, move the swab side to side and the debris will lift up. For removal of milia or pustules, you may choose to use a lancet. However, be sure to check with your licensing board regarding rules for their use, as they may not be allowed in your state. Wrap your fingers with sterile cotton or use cotton swabs. Hold the lancet parallel to the skin and gently pierce the skin horizontally. If you prick into the skin in a downward motion, you can cause scarring. After piercing the skin, gently press down on both sides of the milia and remove it. After completing extraction, dispose of the lancet in the sharps container. Never reuse a lancet. Change your gloves and continue your next step in the facial treatment.